I wish to welcome Melissa King here. She came from United States for our conference, so we're really happy to have her here. She leads very big NGO, Healthspan Action Coalition, that advocates for longevity and lobbies politics to invest more in longevity field. And she was also instrumental in creation California Institute for Regenerative Medicine, big institute that is working towards our cause. So I'm really happy to welcome Melissa on the stage.
Yeah, I can definitely speed it up. Okay, so as we're getting my slides up there, I invite everybody who wants to stand up, stretch, and as Dr. Kalan would have us do, everybody take a deep breath. Do that for 5 minutes, you'll feel great. You'll think my talk was the best all day. So I'm so thrilled to be following all of these amazing talks, but it's also a difficult job. It's exciting for me coming from my background. I'm not a doctor or a scientist, but I've been, as I often tell people, in regenerative medicine at this point for 20 years. And it's weird for me to be able to say, 20 years ago I was doing X, but now I can do that, other than like going to school and riding a bike or whatever. But it's so important that we have scientists like we've had today, doctors, industry, all of us need to get together to support this field. So as Martin told you, I came from the United States. I'm based in California. I'm one of the co-founders of the Healthspan Action Coalition that I hope some of the institutions and companies and maybe patient advocacy organizations, I don't know, that are in the audience today will join. So thank you for starting out the conversation for me on Healthspan. What is healthy longevity? So I'm not a big slide reader, so I hope that everybody that's joining by Zoom can see that. But you mentioned ChatGPT. I'm partial to Claude from the company Anthropic. I love interacting with Claude, which is very similar to ChatGPT. There are some differences. That's what Claude told me these days, based on all of Claude's knowledge, what the definition of healthy longevity is. So if you read that, and I'll read just a little part of it so you get an idea. Individual remains free from chronic diseases. No inflammaging, you feel great well into what we now consider old age. Sure, you're living longer too, but we want to feel good. So I asked you, who would that be good for? And I'll give you a hint. You. Absolutely for all of you. So finally for me, after spending 20 years talking about chronic illness and disease, most people care about that because you know somebody who's had one, right? Maybe they have a spinal cord injury, or maybe you know someone with Parkinson's disease. But guess what? All of us are inflammaging right now. Even if we're using new, we're probably still inflammaging, right? So everyone go out and buy some royal jelly from MedX, you're gonna be fine. So, I know I am. So what would that mean here? And I know that this data was put up earlier in one of the excellent talks, even though I don't speak the language. Luckily, a lot of the scientific information was in English and I was following. Amazing talks, I was inspired. You actually have a longer life expectancy here than we do in the US. And everybody thinks, oh, you know, the US has such great science, but have you looked at our diets? It's pretty bad. My husband's from Louisiana. I love going there. New Orleans, I love eating there. But guess what? New wouldn't be very happy. My ring isn't very happy when I'm there because I'm out late. All right, so let's see. I'm using this, okay. So this is what I believe, and my co-founder and our colleagues all believe that we need more of, and specifically for the field of geroscience, longevity, health span. I prefer to talk about health span for the reasons that were said earlier. We need more patient advocacy, and that's the background that I come from, and I'll tell you about my work in patient advocacy later. I've been squarely involved in public policy, and that's already been said as well. We need a lot more good public policy around this, whether it's policy focused on the individuals and our healthcare systems to get us to pay attention, as we've been hearing about today, or if it's policy that will fund this research, or if it's policy that potentially will protect the science if it needs to be so in some places. We absolutely need more public information about this. I wish that there were 800 people here from all walks of life. And then we also need definitely to plan ahead if we want this to get everywhere, if we want data in the new system from Africa, from Latin America, from all over Asia, not just Japan, Korea, and China, right? And not even rural China. If we really want data from all over the world, which helps all of us, but we also really want the technologies that we develop, and I say we, you're sitting in front of me, not me, but those of us that focus on this field are part of developing. If we want it to be, the benefits of it to be distributed to everybody in the world, we have to think about that now, because guess what? And I know there are other mechanisms. This is just one I know well. The Gates Foundation can't pay for everybody in the world to get all of this that you're learning about today. They're trying, to eradicate diseases in different areas of the world, and that is wonderful from an epidemiology point of view. But this is different, and if we want this information and this technology to go everywhere and to everybody, got to start talking about it now. And luckily, there actually is an Afro-Longevity Conference. A colleague of Martin's and mine on the board of the ILA, Brenda, and her colleagues are putting that on, and I was thinking that you should probably speak there. Honestly, you should be there and get them all to get their data into your system. Just a thought. So this is something that my co-founder, Bernie Siegel, said a couple of years ago when he asked me to join him in this journey. He really, after himself being in regenerative medicine advocacy for 25 years, really believes that this is the next frontier, and it's not a different one the way stem cells, when they were first, embryonic stem cells were first isolated back in the late 90s. It was sort of different. This is not different. It's actually related to a lot of things we already know and we already do, and it's definitely related to regenerative medicine. But there's a lot of work to be done, which is exciting and a little bit daunting. So what are we doing? We are building a global coalition, so that's why it's important to me to be here. So thank you so much for having me. It's an honor, and also it's part of what I want to be doing. We're building this coalition to support this field as it grows. So the scientists, the companies, but also the public, making sure that the public gets the information that it needs and are not susceptible to the snake oil salespeople that are out there. Say that 6 times fast. And so, yeah, there's a lot of work to be done. So we have different types of organizations. This is just a smattering of them, and it's alpha order, so I probably would have like 4 more slides or 5 at this point, because we have more than 200 members as of this month. We started about 2 years ago when my colleague Bernie spoke at the Dublin Longevity Summit, which I did this year, and met Martin in person for the first time, which was great. So we have industry, we absolutely have patient advocacy organizations. I don't know if anyone's heard of the Emily Whitehead Foundation. She's the first person to have been treated with a CAR T treatment for a blood cancer, and she's now a college student. And I know her, and I know the people that run the institute that was named after her by her parents. We have companies in here, and we have venture capitalists at this point, and the reason we exist is to advocate for you. So, and to connect you with others in the field. Like, I've had so many ideas of, you should talk to so-and-so, you should talk to so-and-so, I want to connect you with so-and-so, even just today. So going back to my background and patient advocacy in general, I can't take credit for everything on this slide, but the first thing you see, I have worked on a couple of ballot initiatives, statewide ballot initiatives in California. This is a vehicle that we have in California and in several other states, but not all US states, by which you can approach direct democracy. You can actually go directly to the voters of California and say, should we do X? Whether it's provide better education for kids through age 5, or spend, the first time, Prop 71, $3 billion of state money on stem cell research, which at the time in 2004, when we got that first initiative passed, was important because there was a executive order by the United States president at the time that effectively banned federal funding for stem cell research. That's not what it said, and the scientists in the room know that, right? It said you can only do research on these 60 already existing lines. The idea is that it is unethical to take blastocysts, very early stage embryos, and to remove embryonic stem cells from them. They conflated it with the abortion issue and pushed President Bush to put this order in place. The problem with those 60 existing lines is that not all of them were going to live forever. That's what people like to say, oh, stem cell lines will live forever. Not always. Plus, many of them had been created on mouse feeder layers. So I don't know about you, but if I had a disease, I wouldn't want mouse cells put in my body. I don't want a tail. I don't want any fur. I don't want mouse teeth coming out of my arm. And these are some of the things. I also don't want tumors. These are some of the things that could probably have happened were we to just use those lines in perpetuity. So a group of people got together in California and said, no, we have the 5th biggest economy in the world. At that time, the 5th or the 6th, depending on the economist you talk to. Now it's the 4th or the 5th, right? And the U.S. might be switching with China soon, we'll see. But anyway, we have this benefit in California that we have a good economy, we have lots of universities and other institutions to do research. So we'll do this at the state level. So we did it, we got $3 billion, we created an agency, I was part of building it. From scratch with no model. It's still unique in the US. And the money was sunsetting. So in 2020, we went back and got another $5.5 billion because, as I'm sure all of you know, since 2004, this field has grown. There's tons of industry now, which is wonderful, but even companies, if they're doing earlier stage clinical trials, can't always get the funding for it. So what the agency does now with this $5.5 billion additional funding that we got them, first of all, they can fund clinical trials and have enough to do a lot of them. That's a lot more expensive than working in mice or C. elegans or just with cells. And they can de-risk programs that otherwise probably would die on the vine because the government, at least with the NIH, they don't fund a lot of clinical trials in the stem cell arena, but venture capital sure isn't coming in, that early if you're not through at least I'd say phase 2, and neither are other types of investors. And so this is an agency that can de-risk it. And I'll just briefly go through the rest of these. I want to start by asking, is there anybody in this room that does not know what the symbol at the bottom of the slide, the pink ribbon, means? Is there anyone who doesn't know? Okay, excellent. So 20 years ago, 30 years ago at this point, wow, you wouldn't have known that. Susan Komen died of breast cancer, and her sister got very frustrated that there was a bunch of research being funded for prostate cancer, as much as we love our white men, because the white men in the government were funding the white men in science because prostate cancer was so important to them, but they weren't funding a lot of research in breast cancer. So guess what? Now they do. Now the government does, but also you do, because you give money to organizations like Susan Komen. And by the way, I want to say this isn't necessarily a comment on the organization today and how they function. If you know anything about them and you don't like them for some reason, there's a lot of information out there about it. And so I just want to say this is an endorsement of what they did for breast cancer and science and biomedical research and visibility in the public. JDRF, the Juvenile Diabetes Research Foundation, which is now rebranded as Breakthrough T1D because no one talks about juvenile diabetes research anymore. We talk about type 1 diabetes. They got $2 billion in Congress, and the person who led that effort, because his son was a type 1 diabetic, was also the chair of the Prop 71 campaign and then the Prop 14 campaign that I ran big chunks of, both of those campaigns. Another one I'll just mention briefly, HIV research. When HIV and AIDS first came about, not everybody in this room will remember, but I definitely do, people were scared, but they also were putting it in a box and saying it's those people over there that are getting it. It's a gay cancer. It's something like that. It had nothing to do with me, right? No, you could get it and it would kill you because we didn't know enough about how to treat it. So the AIDS activists and HIV activists, they really had to be activists instead of advocates. And I want to draw the distinction. They had to be radical. They had to throw coffins on steps of state houses. They had to pour ashes of their dead loved ones on the lawn of the White House to get the attention. And guess what they did? And what are we doing now? Actually, the same president that wrote the executive order to say we're not funding stem cells led the charge to eradicate HIV in Africa and make sure that people get the treatments that they need. But I'll say again, the only way that's possible is with industry creating the drugs that are now available after the scientists do the research, and something like the Gates Foundation or the governments of many countries getting together to do it. But advocates can drive that forward in every realm that I'm talking about. So very briefly, these are some patient advocates that worked on Prop 14 with me in 2020, and the gentleman in the middle in the wheelchair was the third patient in the Geron trial, which was the first embryonic stem cell derived cellular treatment trial anywhere, I believe, although we may not know that, but certainly in the US. And he's now on the board at CIRM, which is great. Frances, who you see in the middle in the black with the zipper, the gold zipper, lost her husband and her 3 adult children to Huntington's disease, with her 3 children dying since I've known her and had them come and speak at our meetings at CIRM in the early days. Kristen, to her right, lives with retinitis pigmentosa, is a brave warrior, and has been in a clinical trial for that disease run out of UC Irvine, University of California at Irvine. Next to her is a gentleman with Parkinson's, and it goes on. Behind Frances, on what would be your left, yes, is James in the back row there. You just see his face. He lives with MS. He's now frequently in a wheelchair. All of these people reacted to having their diseases or having family members die by taking action. They're advocates, and they're out there every day helping get, for example, Prop 14 passed to get more money for the research. In Frances's case, she's worried about her grandkids now, but she already lost her 3 kids and her husband. So it's not going to help her. And Kristen was in the clinical trial, and she got a little bit of sight back. She has a little bit of light now, but that's it. She'll probably never see. She's had millions of stem cells injected into her eyes, and she was early. So it was for safety for her. In her case, it really wasn't even efficacy, the part of the trial that she participated in, but they're brave warriors, the patients. I was struck by this quote from Hal Barron because of the fact that, and I know you mentioned Dr. Yamanaka earlier as well, Shinya Yamanaka, who did get the Nobel Prize for discovering how, and I know it was a race, there were others involved, you may even have colleagues that were, but how we can take a somatic cell and reprogram it to an embryonic state. This was great for the ethical issues, but it's also just great generally for the science. I actually know of, I know scientists that have developed IP using iPS cells that is now being used, for example, to try and cure Parkinson's. I'll stop there. I would speak for too long about something that there are other experts on, and I don't need to do that. But so this quote, Shinya, we were funding Shinya with CIRM money to come to California 6 months a year when he made that discovery. He was coming for 6 months a year to the Gladstone industry, and the reason was CIRM at the time that I was there, and Bob Klein, who was the chair of the campaigns, we were very focused on global collaboration. They aren't as much anymore, and I could go into details about why and whether or not that's okay. That's a separate issue. I know the people there, and they're doing really great work with the money that they have, but wow, we had Shinya in the US for 6 months a year when he got that Nobel Prize. And now Hal Barron is saying, he's had a great career in other biotechs, but he's part of the founding of Altos Labs, which you may have heard of if you're in this field. Jeff Bezos is one of the funders. So there's a lot of money behind it. There's great science behind it, people from industry. And he was inspired by Shinya's work, which I can't take credit for the work or even funding the work. He'd been thinking about it for years, but interfacing with him and moving it along. So public policy, it's an ongoing effort. I'm definitely not going to read this slide because I know I need to move along, but there's just so much that as individuals that we can do. Again, I've told you, I'm not a doctor or a scientist. I am now a breast cancer survivor. I came at the second initiative. I was recruited back to lay the groundwork for and run part of that campaign in 2020. And, I won't say it was more important to me, but it was important in a very different way, because I know that I benefited from medical research, because by the time I was diagnosed, there was an assay that they could do on this very, very small mass. Again, I was lucky that they had to remove to figure out whether or not chemotherapy would have been beneficial enough versus the risks of taking it. And the answer was no, which hopefully means I was cured by the surgery. This was several years ago now. I passed the 5-year mark last year and stopped taking tamoxifen. But that wouldn't have been possible a few years earlier, maybe even a year earlier, if I remember correctly. I would have had to go through chemo. I would have lost my hair. I mean, whatever, that's not the problem. But I benefited from your work. That's how I look at it. I've already talked about our 2 ballot initiatives. Right to Try is something that this field will be talking about for a long time, so remember that. So in the US, we have Right to Try at the federal level, and what this means is if a drug or treatment isn't all the way through the regulatory process at our FDA, our Food and Drug Administration, you can still take it with this law if you have a disease. And there's another area of the regulations that's about compassionate use. If you have a disease that will kill you imminently and there's definitely no cure for. But Right to Try itself is moving across our country. There are Right to Try bills that have been passed in many states, and others are being worked on. And there's a new Right to Try bill at the federal level. And many, many other countries in the world have talked about this already, because what happens is you don't want to have a drug available but have people that will die if they don't. Not that the drug will keep them alive, but why not let them try it? They're going to die anyway, is the argument. So thinking about it from a global perspective, I've talked a little bit about the US and how in California we can use ballot initiatives, how federal policy can affect us and potentially shut down an area of science. These are some of the organizations that, if you're looking at this from a global perspective, that you have to interface with. And I know my friend in the audience is familiar with that as well. So I put together all of the different Right to Try legislation that is out there. I'll go through this just very, very quickly. Obviously, it's been talked about in Europe. Anything that's being talked about, I think of it in the US is probably being talked about in Europe. And in Germany, you have actually your own regulation. In Slovenia, you don't yet. But given this crowd and the energy around this field, it's something that I don't even know if you need to consider it. I have no idea how it feels and works, but it's something that you might think about. Canada, Australia, New Zealand, I put the Commonwealth ones all together. It's all different. So one of the points that I hope you're deriving from this is that it is different in every country. So I'm used to saying, vote for this ballot initiative in California, or if you want to volunteer with me, here's what we're going to do. We're going to go outside Best Buy or Trader Joe's, a couple of our big stores in the US, and we're going to collect signatures, because that's how you qualify to be on the ballot. And it's got to be a wet signature. It can't be done online. I get asked that all the time. Nope. And the reason is because someone attempted to change that in California, and that initiative didn't get qualified for the ballot. Which is a piece of irony, I suppose. But anyway, so just looking, this is Asia. You've got it in some places. You've got a conversation about it in Africa. You have laws about it in some countries in Latin America, but certainly not all. A lot more countries there. It definitely in the Middle East is being talked about as well, but no specific federal laws like we do have in the US. So the point again is, if you want to look at public policy or regulation from a global perspective, it's a lot of detail, and you need friends in every country to work on it with you. Public policy and science, I think you can gather that I believe public policy affects science a lot all the time, and we need to be vigilant about that. You can stay on top of that in your country, in your region, and the world, and you can actually do something about it. I started out working in marketing and communications for the technology industry. That's what I was doing when someone asked me to come join that first campaign and as a volunteer and help them out telling some human interest stories, because I could do that from the work that I'd done in the tech industry. And then they asked me to join the campaign. So I don't know the things that many of you know, but I can advocate. Right? I absolutely can, and now I do it as a patient myself. And the reason that this is important is because this field is growing. It's got a lot of eyes on it, and you need public sentiment behind whatever it is you're trying to do, whether it's get funding for the scientists, whether it's have good policy for the science and for the companies that are coming up in this field, or around the need to protect people from those that would like to have them part with their money for something that is fake and won't help them at all. So communications, people in this room as well, you're scientists, doctors, early career scientists, I don't know, maybe you're patient advocates like me, but you are needed to communicate about this science. And I'm a patient advocate from the perspective of wanting the research to happen. I'm very happy that there are others that advocate on behalf of individual patients. That's not me, like walking them through their healthcare, or advocate on behalf of all patients with a disease, like people with Parkinson's should be treated better, or sickle cell. People with sickle cell shouldn't walk into an emergency room and have the doctors assume they're asking for drugs for fun. Believe that they're in pain, that kind of thing. I'm glad that people do that work. My work is to support your work. And you can help me do that by using your knowledge and perhaps your passion to communicate with the public and elected officials and appointed officials and even other doctors and scientists that may not know about a lot of what was talked about today. The doctors definitely don't, right? You can move the needle. I think this is the final thought that I'll lead you with. One of my favorite quotes ever. She was amazing. Definitely never doubt that a small group of people can change the world, and it really is the only thing that ever has. If you really drill down, even when you think about a movement and there are lots of people involved in this, and look at that, and I showed you we have 200 organizations now, but it started with Bernie and me. Bernie ran the World Stem Cell Summit for 25 years. He's a cancer survivor. He was a leader in the stem cell field when it was just beginning because he sued the Raelians, a cult that claimed to have cloned a baby. He sued them and said, produce the baby. The stem cell scientists of the day who founded ISSCR, the International Society for Stem Cell Research, went to him and said, Bernie, you're the only one out there that's protecting us from the public conflating us with those people that said they cloned a baby. So he was on the board of ISSCR when it was forming as a lawyer. As a lawyer, cancer survivor who was doing transactional law in Miami. And so that's my co-founder, and he and I started in this field, like I said, a couple of years ago, and I'm just amazed at the progress. I'm learning the science as we go. I can talk about stem cells, but all the biomarkers and all that, I was reading some of this stuff before I even joined Bernie in this effort, and I'm glad that I was, because it made the learning curve a little more flat for me than it would have been. But it's a lot of information, and it is coming at us fast. And so that will just help me stress again that we need people like those of you in this room to help the rest of the public come along. Get them to sign up for new. Get them to bring it to their doctor and tell their doctor about it, and maybe talk to somebody else that might know about it in order to bring them along if they're willing to do that. I know that's tough for a lot of people with their doctors, but you can do something about all this, and that's what I came here to talk with you about. So thank you. Thank you. I'll stay. Yes.
Do we have a microphone is here? Okay, so we have time for one quick question. Yes, Enay?
I did it to him, so he's doing it to me.
No, very impressive talk, and I used to spend about a decade in the rare disease drug discovery, and I know the impact and the importance of advocacy groups and patient advocacy, so amazing work. My question is, what's the reality in terms of your efforts in the area of aging? So, listening to, for example, the consistently the same messaging by Andrew Steele and the guys like that, right? So kind of his main message is he just paints the picture of cost of death and the amount of funding going into all the other diseases versus longevity, right? Kind of negligible. So kind of coming from this perspective in terms of your track records in the past, how do you see the willingness of where things are starting to move?
Yeah, it's a really excellent question. And I'll start by saying that those same messages that you just laid out are the ones, they were at least part of the messages that we laid out for both Prop 71 and Prop 14 in California, because you will probably never get everybody to vote for something because it might help somebody else, right? And like you said in your talk, young people don't think that they need what you're selling yet, right? They may be not drinking, which is good. That's a trend in that generation. But they're not necessarily not drinking because they know all about, and I'm not saying nobody should drink. I'm probably going to have some wine later. They're not drinking because they know all about their bodies and their biology the way you were talking about. That's just a trend for them right now, right? So when you need millions of people to vote for something, you have to have lots of different arguments, usually including an economic one, because you're asking them as a taxpayer to fund something, right? So we absolutely were talking about the fact that if we just cure one of these diseases that we were talking about diabetes, Parkinson's, ALS, MS, Huntington's, all of the ones, many of them neurodegenerative, for which there was a lot of hope 20 years ago with stem cells, right? Because suddenly we have the ability to develop lines of cells with a disease. We can study them, we can develop treatments for them, and if we just cure one, we're saving billions of dollars a year in healthcare costs. So it is still an important argument and a good one, right? If everybody used your system, we would spend a lot less money on some of those diseases, at least I hope so, right? That's the hope. But in terms of what we argue ourselves, it isn't just the economic argument. And in fact, you heard me say we have to plan now if we want everybody in the world to benefit from this. We actually talk about it in terms of Healthspan being a human right. Just like education in many places is considered a human right. And the thing is that this field, there are so many potential pitfalls for it, one of which is this is a field for rich white men in Silicon Valley that have all the money to do this and pay for it and all of that. And on one hand, I applaud those people, especially someone like we have another speaker later today, Brian Johnson, and I said this to him 2 years ago in Dublin live during the conference. Thank you for being an N of one. Thank you for being willing to do that. Right? And he has the funding to pay doctors, to pay attention, probably to do much of what New can do. I'm going to get New. We're all going to sign up for New, right? Come on. I appreciate that they will do that. And we need more people to do that. But I also want the population of Africa, for example, which is largely young people. They're much younger. Half of their population or more is much younger than me. We don't want the world, honestly, if you look at it economically, to have to either pay for their health care as they age or to watch them die without the care that you can get here or in the US. But I'd rather see them improve their health spans in the ways that they can with their knowledge. We're still going to need the deep science that will get us, treatments that we can't even imagine yet, right? Whether it's metformin, I'm sorry, I could go on for a long time, but whether it's metformin or it's rapamycin or it's something that none of us have ever heard of yet, right? We don't know yet. That's part of the point. And that's why some scientists will say, why would I take rapamycin when it's not proven for this target and it has side effects, which we know from the fact that transplant patients take it to suppress their immune system. But we're microdosing rapamycin. It won't affect us. I won't get more colds than you. The debate will go back and forth. In this field, people argue with each other more than they help each other. So I am here to be one of the people that tries to help. And as you can see, I could talk for a long time on just your question, so I'll stop there.
Thank you.